resurgence of a lot of anti-trans and anti-LGBT bills.
Lawmakers across the country are working to address legal protections for transgender people, parents of transgender youth, and providers of gender-affirming care.
There's some other bills in other states that are saying anybody who's trans cannot get any kind of health care services for trans care up to age 25. So we're not just talking about trans youth, we're talking about trans adults.
And all of this stems from changes this year on the federal and state level when it comes to abortion rights and gender-affirming care.
After the Dobbs decision came down, that scared a lot of people into what is possible that the Supreme Court could do to undo a lot of the protections that have already been done.
According to the LGBTQ+ Victory Institute, these initiatives are led by a number of openly LGBTQ+ lawmakers. These bills would ban law enforcement from arresting people who go out of state to pursue gender-affirming care where it's legal.
Texas would consider gender-affirming care for trans kids, trans youth, to be child abuse. Our legislators are looking for opportunities to send a public message that their states, if at all possible, will become safe havens for those families.
It's a struggle for a lot of people that I talk to on a daily basis in a lot of other states where they can't get that care. And I think about that myself, not being able to get the care that I need. I might be able to get through that mentally, but there's a lot of people who can't.
Colorado Democratic State Representative Brianna Titone is the state's first openly transgender state lawmaker.
There's a lot of people that their gender dysphoria is so bad that they resort to harming themselves and deep depression, and that can ruin a person.
The Trevor Project reports 52% of transgender and non-binary youth have considered suicide. The report also shows that for people under age 18, receiving hormones was associated with nearly 40% lower odds of recent depression and of a past year's suicide attempt. The president of the American Academy of Pediatrics echoes that saying gender-affirming care for transgender children and adolescents is medically necessary and appropriate. It can even be life-saving, which is why Titone is pushing for protection in her state for gender-affirming care, continuing the trend that has happened in 18 other states.
We're going to take a stance of putting up a barrier to make sure that whatever kind of crazy things that they come up with to try to go after people, whether they're providers here or patients coming here, that we're going to make sure that we protect them in every single way that we can and stay within the Constitution. That's the tricky part, is doing this without breaking any constitutional laws.
In Colorado, I'm Thomas Hoppo.